Hey everybody, it's your favorite doctor here, Dr. Tiffany Butler, and thank you for watching the video. Hopefully you watched my previous videos. I'm pretty much taking you through birth until aging process, okay? So now we're going to be talking about adults, and we're going to talk about active adults, and when we talk about active, we're going to talk about seniors too, because they all go into that adult, whether they're an older adult or young adult. What is chiropractic care all about? And how can chiropractic help people of all ages, right? It's like, how can dentistry help people of all ages, right? They got teeth, right? And they got gums. Because dentists don't just focus on your teeth. They deal with the jaw, right? The gums, the tongue, things in the mouth. So how can chiropractors help people of all ages? And chiropractic care, again, I gotta remind you guys, is a form of health care that helps to maintain, improve, and or restore human function through spinal adjustments. That's what we do. As I say, that's the secret sauce, and that's our bread and butter. Now, I'm a chiropractor. I would consider a mixer because I do more than chiropractic, because I believe that sometimes people need other things to assist with the chiropractic adjustment, right? So if the muscles are too tight, lack of mobility, maybe I need to put some heat on there or something else, work on the soft tissues before I adjust, because I get a better adjustment, if that makes sense. Anyway, let me get back to it. So treating people of all ages, and what does it mean to be a family chiropractor or a family chiropractic practitioner or a physician? What does that mean to be a family chiropractor? It means that you can take this person who is, as soon as they're born, right? You can evaluate them, assess them from a chiropractic standpoint, right? And you get a baseline. And you could take them all the way up and you age with them, right? As they go and move through adulthood and experience life, right? Everybody experiences back pain at some point in time. All right. It's just how it is. If you're active, if you're living, you're going to have some aches and pain. Majority of back pain resolves on its own within 5 days. But there are a small percentage of people who continue to have back pain, because back pain, chronic back pain, is one of the top disabilities in the world. So it's definitely a problem. And to give people a means of solution, right, a way to solve their problem without becoming addicted to strong medications, you know what I mean? So chiropractic care can be looked at as a possible solution to treating not only your back pain. And when I say back, I'm not just talking about lower back. I'm talking about your neck, talking about your mid back. I'm talking about your lower back, of course, talking about your pelvis, all right? Chiropractors, we do all that. We also can help with your joints, okay? Shoulders, knees, hips, and ankles. One of the second most common things that people come to me for outside of the spine is shoulders. Third is knees. All right. So we approach things differently. We're looking at things from a functional standpoint in terms of biomechanics. How are you moving? Okay. And if you're not moving well, why not? Okay. Because there's so many things that factor into it besides pain. All right. So as we move through life and we experience things, of course, the majority of people come to chiropractors are adults. However, people forget the elderly, the older population, and they have spines as well. I've treated, I know you probably would say, Doc, you know, I'm a family practitioner, okay? Family chiropractic practitioner. I take care of families because it's important, all right? If you take the child from one child all the way up, they learn from the beginning the importance of keeping good posture. They learn the importance of protecting their backs and reducing their risk of injury, not just the back pain, back injury, but also other areas, all right? So it's super important that we educate patients from a very young age, and then as they move through life. This is about health education and literacy. All right, so I digress. All right, so whatever age you are, you're not too old to get chiropractic care, and you're not too young to get it. Depending on the type of pain that you're experiencing and what else is going on with your body, it's always important to get an evaluation. And that's the best way to start, is simply by talking to a chiropractor. You know, you could talk to people on your own and get their own personal experiences, or you can get your own personal experience. You get their experiences from a third party, right, if you will, or you can talk to a doc for yourself. Why? Because everybody's so unique and different. You know, there are people who say, chiropractic doesn't do anything for me. It never worked. Right? And there's people who swear by it, right? I always say, hey, try it for yourself. Try it for yourself, okay? And then you can make an intelligent decision. You can make an informed decision, because now you have the information, you have the facts, all right? So as a chiropractor, we are trained, I am trained to treat baby all the way up until elderly. And of course, as you move through your career as a chiropractor, you take advanced courses and then you further perfect your craft. All right. So hopefully that's been helpful for you. If you have any questions, of course, shoot me an email and I will answer it. info@drtiffanybutler.com. Continue to create a great day. And as I always say, that healthy mind and healthy body creates a healthy life. Till next time, stay healthy.